The 59th Annual General Meeting and Scientific Conference of the Society of Gynecology and Obstetrics of Nigeria (SOGON) convened in Ibadan, the Oyo State capital, with the theme Reproductive Health Benefits, Panacea for Attaining Sustainable Development Goals (SDGs). The conference extensively discussed the worsening maternal mortality ratio and major contributors to this ugly situation, ranging from inadequate funding allocation for health in the national and subnational budget, insecurity, emigration of health workers for greener pastures, among other factors. However, considering the 2030 target for attaining the SDGs, they say Nigeria can still improve on the poor indices if adequate measures are put in place.
Economic situations. So healthcare financing has to be improved. The coverage for those using health insurance must increase, and budgetary allocation to health, both at federal and subnational levels, has to increase so that people can easily access it. There is need for government to eradicate import duties on equipment for minimal access surgery to make the procedure more affordable.
While visiting the Provost College of Medicine, Professor Temidayo Ogundiran, and the Chief Medical Director of University College Hospital, UCH, Professor Otegbayo Abiodun, SOGON made a donation of health equipment for use at the antenatal clinic and a donation of 500,000 naira to support indigent medical and dental students, a gesture well appreciated and applauded by the management of the college.
Donation of some medical equipment to the hospital, sphygmomanometers, which is what we use to measure blood pressure, and some seats for the antenatal clinic, 24 seats, and 4 sphygmomanometers. A society, SOGON, made a donation of 500,000 naira to the college to help support indigent medical and dental students, so that some of them will now concentrate on their studies instead of scampering to see how to get money for feeding and so on.
Professor J.B. Lawson Memorial Lecture with the topic Emerging Sexual Behavior and Concordant HPV Infections and Cancer in Women, Fact or Fallacy. Professor Mohsin Bello highlighted the importance of sex and new sexual behavior, especially as they relate to HPV as a major etiological factor causing cervical cancer and, more recently, heart diseases. He highlighted the World Health Organization Cervical Cancer Global Elimination Strategy, the promotion of routine HPV immunization in Nigeria, and the need to be aware of sexual behaviors that can cause serious health challenges and worsen our health indices.
The lecture highlighted the importance of sex and new sexual behaviors, especially as they relate and impact on HPV, human papillomavirus, as a major factor in the causation of cancer of the genital tract and other cancers in the body. He highlighted the WHO, World Health Organization, Cervical Cancer Global Elimination Strategy, the promotion of routine immunization for human papillomavirus in Nigeria, and the need to be aware of sexual behaviors that can cause serious health challenges and worsen health indices.
The conference workshop, which started on the 24th to 28th November 2025, drew in more than 300 participants, offering hands-on training and quality workshop on important areas in obstetrics and gynecology.